Hello, everyone, and welcome to Soul Talk Season 2, Episode 9, Embracing Holistic Wellbeing in Digital Age. You already know me, so today we turn our attention to the vital issue of children's health and well-being. In this rapidly advancing digital age, where screens frequently captivate young minds, it is more essential than ever to comprehend and foster the physical and emotional wellness of our children. This is the central theme today, and me being a mother, it was very close to my heart. Today, joining us in this particular conversation is a renowned neonatologist and pediatrician at Motherhood Hospitals in Gurgaon. With an impressive academic background and specialization in neonatal care, he is dedicated to managing the health of newborns, premature babies, and children. His expertise spans high risk births and neonatal disorders and pediatric care, ensuring the utmost care for his young patients. Ladies and gentlemen, please welcome Dr. Sanjay Wazir in conversation with me, Navita Berry, Business Head of Solh Wellness. Thank you very much. Welcome to Soul Talks, Dr. Sanjay. How are you?
Thank you so much. I'm privileged to be here, and in fact, good to be interacting on this platform.
Thank you so much. So, the viewers would like to know the book which you have written, Bundle of Joy. This offers balanced insights into the breastfeeding versus formula debate. There is always a debate between whether it's good to breastfeed or whether it's good to formula. How do you recommend addressing these emotional concerns of parents and older generations, sir?
Well, when it comes to controversy or dilemma, one must understand that in nature there is no dilemma. So for every other mammal, the nature has said you should breastfeed, and as humans, we also understand the importance of breastfeeding, and for that reason, WHO, UNICEF, and most of the official organizations would tell you that 6 months of exclusive breastfeeding, which is good for the development of the brain apart from the nutrition. And you would also understand that there are not only the benefits for the child but also the benefits for the mother in terms of reduced cancer and better weight loss and better regulation of periods, and hence there are multiple, without going in details of that. And for that reason, all medical societies would look at promotion of breastfeeding and protection of breastfeeding. Now, we also understand that in the older generation, there is a tendency for one to think that the child may remain hungry, and maybe the child would want to feed as much, which probably is not right, because nature has endowed hunger to every single child. No one remains hungry, but it is also important to understand that, like, people in the whole family, like any the team, would have different viewpoints, and we must look at, as a medicine, as I said, we look at promoting breastfeeding, but we also make sure that, like, we will listen to the concerns of the grandmother. We need to understand the concerns of the mother, because some may mother feel exhausted, and unless I look after her exhaustion, she's probably not, like, so, in that scenario we tell, okay, you could express the breast milk, let some other family member kind of take it over and give it to the child rather than you doing the journey. But then there would be concerns about, like, is the baby not gaining weight? So these are some of the issues that we've tried to see. Breastfeeding should be protected, and in the book we have also talked about wherever, for one or the other reason, the breastfeeding could not be initiated or could not be continued exclusively. In those scenarios, we say, like, should we introduce formula? We understand that formula milk is also associated with the risk of slight increased risk of infection. So we try to see how to sterilize the bottle in that, and how should people, do formula feeding in case they require, in a safest manner, so that it does not become dangerous for the child.
So, in the generation today, the generation to the new mothers who are, they go through a lot of postpartum depression. And today, in the era of social media, there is an Instagram, there are 20,000 influencers who are talking about postpartum depression. And the older generation who are not on social media, who have gone through all these different generations. They have seen birth of a child and have gone through the same things. Do you feel, sir, that postpartum depression still now in our society is considered as a taboo?
Yes, like, unfortunately, that is true for, most of the mental health issues in the country, across the world. Like, we would tend to see if somebody is having stress, we say, oh, you should just manage stress, you're just too old enough. Somebody say, I have anxiety, I say, oh, that you probably are old enough to handle. And, somebody having other kind of mental health issues, so if they talk in public, they would probably like not get the same kind of support which they should get, because now I'm coming out with a problem. And all said and done, postpartum depression is a known entity after delivery in so many mothers. Now,
Yes.
old mothers, or sorry, old grandmothers, or probably the old aunts would say, okay, you will go through it, but nobody tells you the strategy to,
Strategy.
so somebody says, okay, it is just very normal, you will get over with it, postpartum blues. But, some of the mothers we see would also probably require, antidepressants sometimes, probably, like, of course, before that there are so many other therapies that sometimes we probably ensure that the mother goes through: cognitive behavior therapy, the interpersonal therapy, or maybe joining some of the support groups. Now, the problem with most of the Instagram stories is that Instagram stories come from people who are may not be experts, and
Correct.
within the expert domain also. Say, for example, I'm a pediatrician, but I'm not a qualified, cardiologist. So, in true terms, I may be a doctor, but at the same time, I would not know anything about, or I would not know much about cardiology in a 75-year-old man compared to what I would know. So, within that domain, people should stick to the information which comes from official sources. There are like American Academy of Pediatrics, or American Gynecological Society, Indian Foxy, Indian Academy of Pediatrics, WHO, the host of other information sites, which the information is going to be very, very specific. So in that scenario, I would just suggest that mothers should probably not go to Insta, because Insta is a 20-minute, 20-second video.
Correct.
So you think probably all that information about a complex thing like a postpartum depression cannot be handled in 20 seconds. You would need, like, at least, you don't want to go to a doctor and give you a solution in 20 seconds. So if the doctor cannot give you a solution in 20 seconds, I'm sure no influencer can give you in that length of time.
Absolutely. Absolutely. Um, in your book, Bundle of Joy, sir, have these type of topics, have you talked about these type of topics, or is there a specific chapter in the book which you think the current mother should definitely go through? And if there it is, then how will it particularly help these new generation mothers? Because there is so much of information available on internet, and it's a confusion what to even read or what to even think that whether it's correct or not.
So, in the book, what we have tried to talk about, like, so many, since it's a book about the child care, so it is not too much about the mothers. So,
Mothers.
we have talked about the mothers having a postpartum depression, and how do you manage that. But we've talked large about the adolescent teenagers, like the mental health issues that they tend to get into. We also talked about toddlers discipline. We talked about, like, anger management issues, smaller things which probably would have. The whole idea of getting this book across was because the information was available in plenty, and only 10% was authentic, 90% was unauthentic or non-authentic. We thought, like, probably from our experience, can we amalgamate the latest science, latest research, and as far as the guidelines, into a format which is easily readable for audience. We also understand, like, say, for example, somebody is having a problem for a longer period of time, may not get all the solution in a book, because the book would, for example, look at, and every single child in this world may have their own issues which may be different from a child A to child B. So it is important to have a broad outlook looking at a book, and then eventually, of course, once you have if that thing reading has not helped your cause, please talk to a pediatrician, because he may be in a better position to help you rather than
Absolutely.
any influencer on the Insta or any other platform, because he has a medical insight into what's going wrong with your child.
Correct. Um, so talking about the children and everything, and your book is already talking about it, the toddlers, specifically behavioral issues among the toddlers. So with parents increasingly vigilant about their toddlers' activities, how can they strike a balance between attentive monitoring and allowing their child the freedom to explore and then learn independently? It's a very basic thing, because I have seen when I was also a mother, I wanted my son to be independent. Matlab, it was like, he's just a 3 month. I used to be told, he's just a 3 months old baby. What are you doing? Why you are not nursing him? I told him I don't want him to cling with me, because somehow I will be working back, and then I want him to understand. So that dilemma is always there, and nowadays that increase of the nuclear families, all the parents want their children, their toddlers, to be independent soon. Sir, what do you think should be the strategy? What should be there, the monitoring, the vigilancy, or some other type of new techniques the parents should apply for?
Well, it is true that, like, with the nuclear families, the most mothers are a little bit like apprehensive that, the things should not go wrong. At the same time, they want to raise the children as independent children. Now, the few practical strategies that I would probably suggest, that what are the fears? One is obviously there is a risk of an injury, for example. So you need to ensure that you create a safe environment, and we have added a chapter on child safety, where, for
Yes.
example, baby proofing the living room by covering the electric outlets, securing the furniture to the walls, maybe using edge guards, placing soft mats on the floor. These are the ones which you probably can ensure that at least the risk of injury is reduced, and then allow the toddlers to move around and play safely without having a constant supervision all the time. Because, as you said, constant supervision and apprehension can lead to more apprehension and anxiety, which may be detrimental. You may say, oh, child, do not do this, do not do this, do not do this, and every time you speak like that, he's getting a negative reinforcement, that,
Right.
I mean, I suppose, and then you're going against the theme that you just talked about, that raising independent children who can take their own decisions. So, which is like, but at the same time, it's important to set clear boundaries. Like, for example, you would say, this is like, you can play in the garden, but you must stay away from a driveway or the road, for example. You probably can also encourage self-directed plays for the children, for them giving them a variety of toys which promote independent play, something like building blocks, puzzles, like maybe some art supplies. So it's important to observe, but don't hover around. Don't be over the shoulder and say, okay, you're doing it.
Absolutely.
So and at the same time, you also need to see model independence. So basically, for example, you would need to show a child how to put away the toys after doing it initially together. So once you've finished a play session, the children should know that toys need to be put back. So you could probably do it together
Right.
initially, but then eventually reduce the assistance, and encouraging the child to do it on its own. And this builds the child's confidence and independence in completing their day-to-day kind of tasks. And of course, one must be positive when the child completes the task. You probably say, "Oh, she does put in a shoe," and then you say, great job putting on the shoe all by yourself. So that is also models kind of an independence for the child. And it's important to be consistent in your behavior. So as a parent, I know sometimes you have a call, sometimes you are probably hassled because of the day-to-day working or your own lifestyle or whatever. But then you say, okay, let me take a shortcut. the child would not probably understand that you have a
I do
problem.
that sometimes.
So to model a behavior, it is important that you need to have a consistent routines around. With these kind of strategies,
Absolutely.
the parents can actually provide toddlers with the freedom to explore, learn independently, while also ensuring that they are safe and their safety is being looked after.
Yes. So, sir, today nowadays every child, because of the technology, they all are exposed to mobile devices. So, what would be the effects of early exposure to mobile devices on a child's emotional and social development? We have all seen that nowadays it's said that before 2 years, if the child is exposed to such mobile devices or such technology, there can be a lot of signs of ADHD or autism. These are, sir, just myths, or these are actually some facts which all the parents should be very careful about.
See, this is a known, unfortunately, post COVID, we realized that many children had a problem with their development, especially the speech, eye contact, because what they were living in a virtual, virtual world, and an entity called virtual autism came up, where we said like they were probably not designed to be autistic, but unfortunately because of excessive screenplay, they lost a human connect, they lost a social connect, and in the process they developed what is known as a virtual autism. And there is enough data to suggest that like early exposure to mobile devices can impact child's emotional development, and also the emotional, social connect, attention span, and the impulse control, so family bonding. So the virtually many areas of development which tends to be getting hampered by the user screen. And that is the reason why you would see WHO coming up with the recommendation, American Academy of Pediatrics coming up with the recommendation that less than 2 years you should not have any screen time except for good quality family video calls. Other than that, like till 2 years, we should probably not limit. And the simple reason is that if the child is only wanting to look at a screen, it loses. Like when I look at your face, for example, I can see that you are listening with intention. So I can, even if you are not spoken anything right now, I can make out that you're interested in listening to me. That is a facial read I have developed over a couple of years of my early exposure into this particular thing. But now when I see the children who had no human connect till now, and all of a sudden I can't even read the expression, I cannot even have an eye to eye contact and understand what you're saying. So there are so many factors which will reduce your social connection. And because the brain growth maximum happens in the first 5 years, and maximum in the first 2 years, 80% of your brain grows in the first 2 years. And if you have probably had it an insult, or have had lack of stimulation, which the screens, so many people would say, okay, he's learning to speak A for apple, for B for boy, and he can speak a rhyme, he could probably speak an English in which is much better than someone else. Now that is reverberation that comes from a brain which is lower. So human mind or human brain is slightly different from animal brain in the form that we are able to logically conclude most of the things. We have an abstract reasoning to understand things. We have social skills which are different from mammals. Other than that, you would see on a very joking note sometimes a parrot speaking, A for apple or like something, because that brain is reverberating that information, which is not about the human brain. So it's important that we stay away to just to ensure that you know controlling the attention span, the emotional regulation. So this is, you would find many children who, instead of learning to self-soothe through the activities like drawing, deep breathing, they might just become reliant on, and this is true for older children. They become reliant on screen time to manage their. So you see, if you are stressed, Even for adults, I see many times, what do? They pick up their phone, they start scrolling something, looking for information to satisfy their brain. Well, like, where is, and it's not uncommon. You go to a railway station, airport, everybody is busy doing something. But unfortunately, for a child, this could mean a lot of problems. A child who spends several hours daily on a tablet may finding challenging to focus on non-digital activity like reading a book, completing homework.
I totally agree.
You know.
It seems like you're telling me my story. All the parents today, it's a task. So I have a 11-year-old son. He has sensory issues and has ADHD too. So his tablet time every day from Monday to Friday is like an hour, or 45 to minutes to 1 hour. And Friday is his Netflix movie time where he watches one animation. So Monday to Friday, it is fine. You have a routine, everything is set how you told earlier. Havoc happens on Saturday and Sunday when there is no routine because school is closed, there is no homework, there is nothing to do. Like, what am I supposed to do? What am I supposed to do? So children today are so much engraved into this technology that they don't understand the meaning of boredom. For them, it is like, okay, my tablet is off, just the switch off. What am I supposed to do? I'm bored.
No,
Do something, do some coloring, do something, read a book. I'm bored. It's all boring. You tell me all boring things.
so
Children
that
are like that. And it's not my story. I have heard from every mother, it's the dilemma. They all have this same story. What are we supposed to give to these new generation children? It's a havoc to at least let them understand ki bhai chalo. They don't want to go to the park. So another different issues we have with them.
See, I think, like, I hear this complaint day in and day out in my clinical practice where people say, okay, how do you engage children? I said, the way you engage your team members. So what is so difficult? So you go for a movie out, like, rather than, movie at home, because you feel lazy enough to spend that time. So when you can plan from Monday to Friday about your work, about the thing,
Yeah.
you do not plan anything. You want Saturday to unfold like this. And for the child, it is very difficult to say, okay, energy levels for a child and us are completely different. He wants to be continuously, he's curious by nature, and he is good enough to go to a playground, provided he finds that the parents or the other members are kind of activity. So, like, for example, you said you have that problem and your friend also has a problem, and maybe two or three friends have the same problem, but why not arrange a play date and go for a picnic
We
where.
tried that also, we tried that, and these children, you won't even, they were only doing, okay, this, my Nintendo has this game, what is the game your Nintendo has?
So
And
this,
hello,
see,
excuse me, the play date is without the technology. No, they want to do that only.
so,
It
so
was a
tell
havoc.
so tell me one thing, did you as parents go without your mobile phones?
No, but we did. We ensured we are not touching our mobile phones when they're. We
That's
tried.
like,
So the thing was, almost for 40 to 45 minutes, we had to go through, and we had a lot. We had to have lot of patience. We had to be very calm. And after 45 or maybe 50 minutes, I could see, okay, 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 one line. Okay, I'm also making this bookmark. Okay, okay. So it started like that, but it took at least 50 minutes for them to start. Matlab, to come out of that aura of that technology and then start doing something. So you're like, chalo, kuch to
yeah,
hua.
so you're perfectly right, because I'm used to a particular kind of a lifestyle for the rest of the week, or last couple of years, and just because we went to a picnic once would not change in an hour or so. But, like, at the end of the day, you need to understand that children's behavior is moldable. You probably have to
Yes.
set example yourself. If none of the parents went without a mobile phone to the park, and you can't expect a child to, like, do something like, getting rid of his Nintendo game because it's more pleasure. So, I mean, model a behavior, a child's kind of behavior, much interested, much of this behavior comes from role modeling his parents.
Correct. So we have a very strict thing that at the time of food on the dining table, no screen is allowed. So he sometimes it happens, some other person of the family, maybe the older generation, they want to watch a TV, or you can't say no to them at that time. The parents are, they don't have any option. And the similarly, because always the grandchild and the grandparent are always against the parent, because that is the common enemy they both have. So
I know.
it's a very tough situation to be in.
I
But
know.
yes,
That is
you're
that's
absolutely
very,
correct.
very. Hmm.
And there is always this today's generation has lot of awareness, especially the parents also. So a fight between the old generation and the new generation is very much another issue in the child behavior.
So that's
Anyways,
right. So that's a problem with like an Indian mindset,
in
and
Indian society, correct.
so it's important that you probably would need to see, okay, all problem like any workplace problem can be addressed by effective communication. So
Correct.
if you don't get along with your boss, say resignation is not always an answer.
I totally agree, doctor. Anyways, I really had a nice time going through all this, and the topic is very, very close to me because I am also I was a mother when I had a normal delivery, and I went through this postpartum depression. And at that particular time, 12 years ago, I had no idea about it. Now I am going to when I read this, because of the influences and so much of information available. Oh, acha, aisa hua tha. Oh, now I know what happened. What was the reason? So it's like that I'm coming to know, okay, this is why I was feeling like that. I was so in an angry zone and all those things. But the book of yours, I hope all the parents and the new generation who read them, the bundle of joy, our subscribers who read them, they would have a lot of information and it will actually help them out. So thank you, Dr. Sanjay, for sparing this time and telling our audiences about the book and these particular taboo topics which people want to talk about but don't know where to talk and where to exactly listen to. So thank you so much, Dr. Sanjay.
Thank you. It was a privilege to be here, and I really thoroughly enjoyed being here and talking to you.
Thank you, Dr. Sanjay. Thank you so much.